Ranjeet Brar, NHS consultant, physician and surgeon, is once more sharing his time with us. Dr. Brar, 100,000 plus dead now, and if you're looking at some of the front pages in the UK today, you might not really get that severity. Do you think the media has given the Prime Minister some cover here?
Amina, good to be with you. Thank you for having me. I think it's a shameful and painful milestone for our country, which remains the sixth richest country in the world. I do think our government is very much culpable. There are features of our population, its age, its comorbidity, its diabetes, its obesity, things that you mentioned in your clip there. But there are very much features also of widening inequality gap, of the economic crisis, and of the attitude of the government itself, in particular, the fundamental free market fundamentalist, laissez-faire, anti-state attitude of the government, which is their core ethos, and epitomised by Dominic Cummings, the now sacked and disgraced advisor of Boris Johnson, who said quite openly at the beginning of this pandemic that the government policy essentially would be herd immunity, protect the economy, and if a few pensioners die, in his own words, so be it. That was reported, then subsequently denied, but it has really underpinned the poor leadership, poor management, poor levels of scrutiny, the failure of our political system really to give any kind of decent scrutiny, opposition, or have any ability to intervene on behalf of the citizenry of our country, Amina.
Well, we're putting our hopes here on the vaccine rollout, but even that hasn't gone to plan. What's happened?
Well, if you look at the measures that have really worked around the world, and I particularly look to China because they gave such a startling example of how correctly to handle this with non-pharmaceutical measures. It was absolutely possible by targeting economic measures, health measures at the problem, protecting lives first and foremost, to stop the problem in its tracks. Now, of course, we've failed to do that. The disease COVID is endemic. It's in our hospitals. It's in our society. So we are very strongly relying on the vaccine. But of course, there are problems with supply of vaccine. There are problems with rolling it out to such a large population. Already we're seeing our countries failing to honour its obligations to supply the EU. Likewise, the EU is threatening trade sanctions against us so that we won't get the Moderna vaccine. We haven't got enough, so we're going to a 1-dose as opposed to a 2-dose regimen, for which there's very poor levels of evidence. And we know that people are, in fact, getting the virus, though hopefully a mild course of illness, having had their first course of vaccine. So at the moment, a very small part of the population will be protected because so many of those people who have had the vaccine, maybe 6 million, close to, still are not really adequately protected at this stage. So the vaccine is the one ray of hope in this story, in what has otherwise been a chronicle of really abuse of power, of corruption and mismanagement on a governmental level, with an underfunded NHS which is really struggling, manfully, but struggling to pick up the pieces of the administration.
And very briefly here, Dr. Brar, we heard the Prime Minister in that clip say, now is not the time for these questions, but for unity. How does that sit with you?
Very poorly. The whole point of questions and scrutiny is to be able to change direction. The direction of this government has been, as outlined, a punctuated herd immunity that's allowed the virus to spread, whilst doling out huge amounts of money in an unaccountable, a very opaque, clearly, however, corrupt manner to people who have failed to do the job, whilst simultaneously directing hammer blows against the NHS of further privatisation and deprivation of funds under the slogan, perversely, of protecting the NHS. I'm afraid to say quite the reverse is the case. The problem with British justice and its inquiries is they're notoriously late after the event and don't reverse the fundamental direction of travel. What we need is effective political opposition, but sadly that's lacking in our country at the moment, Amina.
All right, Ranjeet Brar, thank you as always.